Hey guys, hope you've been well. We are back. Dr. Kristina is back on set. I don't know if Dr. I should introduce you anymore.
Maybe there are those who don't.
There are those who don't know you. So Dr. introduce yourself.
Hi everyone, my name is Dr. Kristina Sule and I'm a consultant obstetrician and a general and cosmetic gynecologist at my private practice, Alora Medical Practice, and thank you so much for once again having me here, Kathy.
You're welcome. You're welcome. We had missed you.
Oh, thank you.
On today's video, we're going to be talking about abnormal periods. And before we even go further, I'd like to ask Dr. what is abnormal periods? Because I guess that's a very broad statement. So please.
Yeah, so abnormal periods, and why it's really important for us to understand what a normal period is because when we know what a normal one is then now what informs us on what an abnormal one is. So generally a period cycle, that's a cycle length, is supposed to be between 21 and 35 days.
Okay.
So if your period cycle, meaning from the day it starts to the day it comes again, is less than 21 days or more than 35 days, that's actually abnormal. Less than 21 would be a very short cycle and more than 35 would be a very long cycle. Okay. Now that's in terms of the length. Now in terms of the days you're supposed to actually menstruate, it should be between 2 and 7 days. So if you menstruate less than 2 days, that's very little menstruation. That's a very light menstrual period. And if you menstruate more than 8 days, that's a problem as well, yeah, because that's a prolonged menstrual period. But there's also other abnormalities that women face. For example, a painful period is actually an abnormal period. And by pain, we're talking about a period that's debilitating you. You can't go to work, you can't go to school, you can't perform your functions, something that keeps you at home bedridden, you know, or something that requires very strong medication, like women who have to go for injectable medication when they have a period. That's not a normal period, yeah? Or a period that is very heavy. You know, women who have to change 10 to 12 pads within the day and there's still another coming in the night, or use a tampon plus a pad because they're gonna leak and the blood is gonna go everywhere. So when it's very heavy, that's also a problem, yeah? And then also if it's very light, you know, like a woman who gets just spotting for a few hours in a month, that's also an abnormal period. So if it's extremely painful, extremely heavy, extremely light, too long, too short, those are all abnormal periods.
Okay.
Yeah.
And is age a factor?
Yes, age is a factor in two ways. For example, if a woman is menopausal or perimenopausal, then of course we expect her periods to start coming less frequently. So sometimes I get patients who are like 48 years old and they say, look, I've only had, say, 3 periods this year. That's actually not unusual because they're approaching menopause, so the periods need to get less and less. And at the same time, in terms of age, we have girls who have just started their period, so their body does not know how to menstruate. It needs to learn and develop a cycle. So those kind of women those kind of girls will also not have a regular period. And sometimes a girl can have a period start and then have nothing for 3 months, and then it comes back, and that's perfectly normal because the body is still learning how to menstruate. So age is a factor, yes.
Age is a factor. Yeah. So Dr. for I'm talking about maybe most women, is I think we are taught growing up, you know, periods is do you walk into a doctor's office, do you walk in a gynae's office and say I'm here because I have irregular periods? What would you say about that to women? Would you, if they, because they know their body best, if they sense that they have irregular periods, is it okay for me to walk to a gynae's office and book a consultation? Is it reason enough?
Yeah, actually that's a really important question because we want to create a culture where women attend to all their reproductive health needs, yeah, anything that seems abnormal to them. So maybe when you are growing up, when I was growing up and you had an abnormal period, either something that was irregular or too painful, you'll be told by a parent, like, look, this is what to expect, like that's how just a woman's life is, you know, no need for concern. But we want to develop a culture where, first of all, girls see a doctor upon their first menstruation or even prior if possible, so that they can have a talk and just understand understand what the expectation should be, feminine hygiene, you know, so that when their period, the cycle, so the period disappears, they're not worried. They're like, oh, this I already discussed with my gynecologist. So just a culture of coming to see a gyna early, immediately menstruation starts. But also as it continues, whenever there's a problem or there's any kind of abnormality, one needs to be able to see a gynecologist, because if you miss a period, sometimes it could be something as simple as pregnancy. So you really do need to see a gynecologist. You know, it's very important. If there's any abnormality that you note, you'd rather be reassured by your gyna and told, look, this is nothing to worry about, than find out that it was actually something really serious that required attention a lot earlier. Yeah.
What could make your period irregular, Dr.?
So there's a number of reasons why your period could be irregular. I think the most common one is pregnancy. If your period disappears, the first thing I think your gynecologist has to do is confirm that you're actually not pregnant. So for me, in medical school, we are taught any woman who comes with a menstrual irregularity is pregnant until proven otherwise. So now, once we have confirmed that it's actually not pregnancy and we can put that aside, then there's actually many reasons. A woman could be on contraception, which could make her period irregular, especially if it's progesterone-based contraception, because that tends to make your period disappear sometimes. It makes you get spotting occasionally, either before or after the period or in between cycles. So one must consider their contraception. Or once again, as we mentioned, it could be just an age issue, such that it's very early in life or very late in life, where your cycle is just naturally either beginning to pick up or, you know, kind of dying down. Also, we could have things like polyps. When you have a polyp, is like a benign growth in the lining of the uterus. When that happens, it could make your period quite irregular. You could have spotting in between periods, or it could make your period very heavy or very painful. So that's one other thing. Women who have hormonal abnormalities tend to have a very irregular period, and some of the hormones that could be affected are, for example, the thyroid hormone. When a woman has a thyroid abnormality, she could have an irregular period, either high thyroid hormone levels or low hypothyroidism. Other hormones are like prolactin. It's a hormone that is produced in women who are breastfeeding, but it can also be produced in excess amounts in women who are not breastfeeding, and if that were to happen, it can make the period quite irregular. At the same time, we have women who have polycystic ovarian syndrome. This is once again a hormonal abnormality, but it affects the entire body. These are women who produce large numbers of cysts in their ovaries, and every single cyst they produce is releasing its own form of hormone, and that causes a hormonal abnormality. Such women have very high levels of testosterone, which are male-related hormones. They have abnormalities that basically make their period become either very short or disappear completely for months. We have women, for example, who have
maybe endometriosis. Would you want to say that?
Yes.
Endometriosis?
Yes. So endometriosis can cause an irregular period, but the main symptom of endometriosis is actually a painful period. So the women, of course, who have very painful periods, and when we discuss that, we'll be able to see what are some of the other causes, but the irregularities are mainly the ones that we've mentioned. There's certain women who get a condition called premature ovarian failure, which is where they stop ovulating or menstruating at 40 or by 40. If this happens and a woman stops having periods or stops having signs of ovulation after 40, it could be that she has premature ovarian failure, which could be another reason why she's having irregular periods. So it's just a complete shutdown of the ovary. We're not really sure why it happens, but it can just happen. Also, we have women who have irregular periods because of weight. And by weight, that could either be severely underweight or severely overweight women. So obesity can make your period actually disappear. Women who have very high BMIs tend to have very few periods in a year. And then also women who have very low BMIs or what would possibly call anorexia or malnutrition, they also have very regular periods. There are times a year can pass without them having a period. So weight is a huge factor in terms of period, and we cannot exhaust all the reasons for an irregular period, but one of them, last but not least ones, is stress. Very high levels of stress can actually make your period completely disappear. And one, of course, I think that's easier said than done to manage, but stress levels can also affect how you menstruate.
Again, I can't emphasize enough, and I always emphasize this on these videos. please seek professional help. It's better to go to the doctor and the doctor to tell you, go home, there's nothing wrong with you, than it being a symptom of something bigger. And don't shy away. You don't say it's just periods, and brush it off. Yeah. It's, you know what, it's not a big deal. Yeah. Okay. When you notice anything abnormal with your periods, please visit the gyna. I've met a few women who say, when they have periods, like, it's such a painful experience. Yeah. It's so painful. They have to go to get injections. They have to take time away from work. It reduces their productivity. It's actually a time of the month they dread. Yeah. So what could be the reason for painful periods, extremely painful periods?
Yeah. Just as you've said, painful periods, actually pain during periods is one of the most common symptoms of period abnormality. Mm-hmm. First of all, women need to understand what is the threshold of pain. Many people ask me, how painful is painful? Mm-hmm. It's a very difficult question to answer, but basically, as I'd mentioned before, your period pain shouldn't debilitate you. Mm-hmm. You shouldn't be bedridden. You shouldn't be, you can't leave the house. You can't perform your functions. You shouldn't have injectables, because all that just signifies that the pain is actually way too much. Mm-hmm. But some of the reasons why you could be having a painful period, and the most common one, is actually endometriosis. And endometriosis is where the lining of the uterus escapes the uterus and goes to a different site, right? And so this lining is now found in a new site, and that could be the ovary, the top of the uterus, the bladder, the rectum, any organ in the abdomen, any organ in the chest, honestly, even the brain. It could go anywhere in the body. The most common location is obviously in the pelvis, which is in the ovary, on top of the uterus, and other organs in the pelvis. Now, when it goes to this new area, it actually sheds itself in that area. So because it is uterine tissue that is supposed to shed itself, so it secretes itself, and in that process, it causes a lot of pain, a lot of inflammation. It makes organs start to stick together, which is what we call adhesions, when one organ is stuck to the other. So like the uterus is stuck to the fallopian tube is stuck to the bladder is stuck to some other organ, and organs in the pelvis need to move freely. So when they're not able to move and there's a lot of pain and inflammation surrounding them, of course the patient ends up having these symptoms. So painful periods, majority of women who have endometriosis have painful periods, and vice versa. But of course, just because you have a painful period doesn't mean you necessarily have endometriosis. There's other things that could cause a painful period as well. Women who have fibroids, uterine fibroids, tend to have very painful periods as well. Women who have pelvic inflammatory disease, an infection of the pelvis, which is basically starting off from a vaginal infection that goes to a cervical infection that ascends up the uterus, goes out of the fallopian tube, and now infects the pelvis. So usually they have a lot of fluid in their pelvis. They have pain during menstruation and even when they are not menstruating, but specifically when they're on their period, that could also be a cause for a very painful period. Women who have adenomyosis, which is very similar to endometriosis. It's basically when the lining of the uterus, which is, by the way, what we're supposed to shed as our period, it now penetrates the muscle layers of the uterus. And when it sits in that muscle, when the time comes of the month for you to bleed, it bleeds inside the muscle of the uterus, which not only makes the uterus extremely large, but that is a really, really painful process. So there's many reasons, but those are the major ones that would make a woman, have a painful period and that are cause for concern and possibly immediate action.
There's also a factor of very heavy periods, the very heavy periods, and you risk getting anemia. Exactly. You risk feeling lightheaded, and sometimes you have no energy, and it's continuous heavy periods. What could be the reason for that?
So women who have heavy periods, it could really be a myriad of reasons once again. Uterine fibroids being the most common reason, and specifically uterine fibroids that sit inside the cavity of the uterus. Remember, in our previous fibroid video, we have fibroids that are on the outside of the uterus. We have fibroids that are inside the muscle layers of the uterus, and then the ones that sit inside the cavity of the uterus. For the ones that are inside the cavity of the uterus, they interfere with the nice contour of the endometrium lining. And so when that happens and they disrupt that contour, it starts to bleed. It can bleed in between periods. During the period becomes very heavy. And of course, as you mentioned, there's a lot of blood loss that is involved in that, which eventually can be very dangerous for the body. So fibroids is one of the reasons. Adenomyosis is also a reason for heavy bleeding. Women who actually have a blood disorder, so women who are not able to clot their blood very well. And you see the women who come and they tell a doctor, me, I've always had a heavy period ever since I started my periods, but actually they have a bleeding disorder. And that's something that needs to be diagnosed, which is another importance of, seeing a gynecologist so they can make that diagnosis for you. As I previously mentioned, a woman who has a polyp, which is a growth inside the uterus, could tend to bleed quite heavily. Women who have cancer, both cervical cancer and endometrial cancer. I remember the very first cervical cancer patient that I lost at Kenyatta Hospital when I was a registrar was a patient who came in, she was 28 years old, came in with cervical cancer, stage 4, and a very, very heavy amount of bleeding, torrential bleeding. So sometimes you just think my period is heavy, but actually it's late stages of cervical cancer, or late stages of uterine or endometrial cancer. So cancer is another reason why a woman would bleed quite heavily. Sometimes a woman gets erratic heavy bleeding, just a one-off heavy bleeding, and she doesn't really know where it's from. And an ectopic pregnancy could be another reason. You could actually be pregnant and be having a pregnancy in your tube, and for that you don't get very heavy vaginal bleeding as such. It could happen, but you get a lot of pain, a lot of abdominal distension, and actually you're bleeding into your abdomen and you're not aware, and it can be fatal. You can lose a life from that kind of heavy bleeding. So another reason why a woman would bleed heavily is because maybe she's on medication that is making her bleed heavily. Like, for example, if a person were on a blood thinner, patients who have deep venous thrombosis or any other kind of thrombosis, and they have to be on a blood thinner when they have their period, that period is very heavy. And of course that's something that a woman needs to be aware of. If she ever has to go on that kind of medication, she needs to understand that the period is going to be quite heavy. Women who have certain forms of contraception, like the copper intrauterine device, comes with a lot of heavy bleeding in some women, bleeding in between periods. Many women after insertion notice their period is much heavier, much more painful, with a lot of spotting in between periods. So those could be some of the potential causes of heavy bleeding. Yeah.
I think when you talk about bleeding, Dr. I don't know if it's something you've seen in your profession. Do you think there's a stigma around periods and women bleeding? Do you think it stops women from saying when something is abnormal or when something doesn't feel right when it comes to our periods?
Yeah, there's definitely a lot of stigma that surrounds periods. And maybe it's a cultural issue, but it's something that is ingrained into us from the time that we start menstruating. That if you're a girl, if your period is heavy, it's a bad thing, or you have to hide your period.
Shameful.
Exactly, it's a shameful thing. So there's a lot of stigma that surrounds periods. Of course, even our partners and spouses also develop some form of stigma to a woman who's having a very heavy period. They wonder, is she having cancer? Is she infertile? What problem is happening here? Why is her period so heavy? And even a lot of stigma in the workplace. Women are at a meeting, they know they have a very heavy period, they can't walk out of the room because they know maybe there's some leakage that's happening, or the period is so heavy it'll pour down her legs, so she literally can't even leave her desk to even go and change her her sanitary wear. And it happens even amongst doctors. Sometimes we're literally operating in a surgery and you have a heavy period and you can't walk out, and you wonder, what will people say about me, if I stain myself. So there's a lot of stigma that surrounds menstruation, for sure.
Which also means we need to have this conversation. We also have to have our men also having these conversations.
Exactly.
And to let women know it is okay if it happens, not reduce the judgment. Before we go to diagnosis, Dr. there's a myth that we hear many people saying around us in society, especially women, among women, if you have very painful periods, don't worry. When you give birth, your first child, the period pain will go away, and you won't bleed as much. Just wait till you give birth.
Well, that's actually not entirely untrue. It's not untrue. you shouldn't wait. You should seek help. But
we're not waiting.
You're not going to
We're
wait.
going to seek professional help.
But it's not entirely untrue, and this is the reason. Remember, I mentioned majority of women who have painful periods actually have endometriosis, and endometriosis and endometriotic tissue grows under the influence of estrogen. So as long as you produce estrogen, you're always at risk of having endometriosis. When your estrogen production stops, like towards menopause, it's difficult to get endometriosis, and also the endometriosis symptoms for those who have it start calming down, sort of. Now, when a woman has endometriosis, because the endometriosis grows under the influence of estrogen, usually if we choose to give her hormonal therapy, one of the ways we treat it is by giving her progesterone, because progesterone will counteract the estrogen. Now, during pregnancy, we produce a lot of progesterone. So for women who manage to conceive while having endometriosis, during pregnancy, the body produces so much progesterone that it literally makes the endometriosis shrink. So the body is treating itself. And because the progesterone that will be produced over 10 months of pregnancy, it's like a 10-month progesterone therapy. So sometimes all the endometriotic tissue can shrink and even disappear, which is the reason why after delivery, there's no more period pain, because the endometriosis is actually being treated by the body being pregnant. So it's not entirely untrue. It does actually make a lot of sense, because it's like receiving 10 months of high-dose progesterone therapy, and then now once the pregnancy is over, the endometriosis has been treated, and that's why the period doesn't come back as being painful. That doesn't mean that a woman can't have endometriosis after having a baby, or can't have painful periods after having a baby. That's possible. But for the women who have normal periods or painless, or just the period that's not minimally painful period after a baby, that's the reason.
Okay, there's a medical science.
There's an explanation.
There's an explanation to it. Yeah. We move on directly to diagnostic. So I come to you, we've ascertained that I have abnormal periods. What are the tests that you will suggest for your patient, or the tests that people usually run after we have ascertained that you have abnormal periods?
Well, there are very many different tests, and of course the testing really depends on the kind of abnormality that you have. For example, if a woman were to come with a very heavy period, one of the things that I would want to do is an ultrasound, because I want to see what is the structure of the uterus, what is the structure of the ovaries. Does she have a fibroid, for example? Does she have an ovarian cyst, which could actually be endometriosis? How is her uterus, ovary, and cervix looking like, such that we can know, is there an immediate reason that we can point out and say this is the reason why you're bleeding heavily. Another test, so ultrasound is one of the really basic tests that almost all women would get when they go to see a gynecologist. Another test would be a blood test to see the hemoglobin levels, because if you tell me that you've been bleeding heavily, I need to see, do you have anemia? Even before I attend to what is causing the bleeding, I want to see what effect has it had on your body. So a blood test just to check the hemoglobin levels, and also to check how you're clotting your blood. Maybe you have a clotting disorder and we just think it's a heavy period. So that's one of a blood test, or a hemogram is one of the tests that you would have to do. Some women have to undergo magnetic resonance imaging, or an MRI, and that's really useful in diagnosis of things like endometriosis and also adenomyosis. They tend to be seen a little bit better on an MRI than they are seen on ultrasound. In fact, an ultrasound can completely miss endometriosis, because endometriosis has a very unique character. The size of the endometriosis is not equal to the amount of pain that you feel. So you can have a very tiny spot of endometriosis that gives you a lot of pain, and you can have very large endometriosis that doesn't give you any symptoms at all. So an MRI would be really useful in this case. At the same time, some women undergo laparoscopy, which we call diagnostic laparoscopy. So basically what that means is that we have a minimally invasive surgery. We make a 1 centimeter incision in your belly button and 2 half-centimeter incisions in your sides, and we go in with a camera and we actually look with our own eyes. And this is the best diagnosis for conditions like endometriosis. We see it with our own eyes as the doctor. We take a sample of it, and then the lab confirms to us that yes, actually this is endometriosis. So not only for diagnosis, but also if during this particular surgery we find that the organs are stuck together, we can separate them so that the pain is not so much. If we find a big area of endometriosis on the ovary, for example, we can burn it or we can cut it out so that the pain during the following cycles is not so much. Remember, as much as we may cut it out, you're still producing estrogen. So as long as you produce estrogen, you can still get endometriosis. But diagnostic laparoscopy is one of the best ways of diagnosing endometriosis, but also other conditions, because we get to make a diagnosis and give an intervention in the same sitting. At the same time, some women have to undergo something called hysteroscopy, which is where we look at the inside of the uterus with a camera. So the good thing about it is that it's non-invasive. You don't have to cut the body in any way. We just literally put in a camera into the cervix and we look at the inside of the uterus. So if you have a fibroid inside the uterus, not only can it be diagnosed, but it can also be removed in that same setting. If you have a polyp growing inside your uterus, we can remove it. If we find, for example, the lining of the uterus is too thick, a condition called endometrial hyperplasia, where the lining keeps getting thicker and thicker and thicker because of hormonal imbalance, we're able to remove that lining and then maybe treat you with hormonal therapy that will make the lining not grow back as much, like a Mirena, for example, is good treatment. A hormonal IUD is good treatment for that condition. So those are the basic tests that one would undergo. Some would have to undergo more extensive testing, like a CT scan or a different kind of testing. But those are the major tests that one would have to undergo. Yeah.
And all these tests are available in Kenya?
Yes, everything is available in Kenya for sure.
Everything is available,
yes.
What are some of the consequences of not attending to abnormal periods?
Well, the consequences really depend on the cause of the abnormal period. For example, if you have polycystic ovarian syndrome, for example, these are women who have polycystic ovarian syndrome get a condition called endometrial hyperplasia, where the lining gets really thick. It's supposed to be shed, but it doesn't get shed. So over months, it keeps accumulating and accumulating, and then eventually it starts shedding itself, and then the shedding becomes very prolonged. Now, if you allow that lining to keep accumulating and accumulating, it's forming more and more cells. The way the body is designed is that when we form many cells, initially that cell formation starts out as normal, but before you know it, the cells that are being formed start becoming abnormal, which is what is cancer. So women who have polycystic ovarian syndrome and get endometrial hyperplasia, if they don't set it out, they could actually get endometrial cancer, because the cells keep being produced and produced and produced until now they start. It's like a factory. At some point it will make a mistake, and those mistaken or abnormal cells is what is actually cancer. Yeah. And then also women who have polycystic ovarian syndrome, for example, are predisposed to insulin intolerance. And when you have insulin intolerance, you predispose yourself to type 2 diabetes. So you could become diabetic just by not attending to your PCOS, and that's a huge consequence.
Which is not necessary.
Of course, and it's something that could be sorted. Women who get really bad uterine fibroids, for example, if the uterus gets very heavy, it can start lying on an organ, on a different organ. So for example, if the uterus starts lying on the ureter, which is supposed to conduct urine from the kidneys to the bladder, you could get acute kidney injury or kidney failure just because your uterus is not allowing urine to flow from your kidneys. Or if the uterus, for example, started to lie on the blood vessels that conduct blood from the abdomen to the lower limbs, and you get a clot in your lower limbs, and that clot dislodges to a vital organ like the lungs or the heart or the brain, that could be fatal. So your fibroids could actually kill you by forming a clot. So there are very many conditions, there are very many consequences. Any disease needs to be attended to. Nothing should be left untreated. But you can understand that not attending to a period can actually make you get kidney failure or even cause you to die. Yeah.
And it's something that you can be able to, the bleeding, I'm able to see.
Exactly.
It's something that you can easily.
It's visible.
It's visible. So if it's not happening and there are no reasons of why it's not happening, it's not explainable. Yeah. There's no reason to suffer.
If it's hidden, other than the fact that we should go for screening, if it's hidden, it's kind of forgivable. But with visible things, really, they should be attended to.
And to finish off the video, Dr. Ari, because we always want to give hope. And you know, at this point you're just like, hey, for a woman it's a lot. You know, we have periods to deal with, painful periods, bleeding, heavy bleeding, anemia, you know, our lives have to stop, we have to give birth. But to give hope, what are the possible solutions and that are out there for abnormal periods for women?
So the solutions rely heavily on the cause. So it's not one solution fits all. As long as you have an abnormal period, there's a solution. No, it doesn't work like that. It depends what is the cause of your abnormal period. So for example, if you have fibroids, we have solutions like surgery. We can remove the fibroids. We have solutions like a GnRH therapy, which is basically a hormonal therapy that helps them to shrink, although not all women are candidates for it, and majority of women actually just have to have surgery. We have another solution called uterine artery embolization, which is basically where we create a synthetic clot in the artery that supplies the uterus. So we deny the uterus its blood supply, meaning the estrogen cannot reach the fibroids, so they just start shrinking and eventually they disappear, or at least they stop causing the symptoms. Also a really good therapy. Once again, not everybody is a candidate for that therapy. We have hormonal solutions, as I mentioned, like the GnRH therapy. We have hormonal solutions for endometriosis. We can either give oral progesterone for some months, or we can put in a hormonal IUD. That's another solution for painful or heavy periods. It's actually able to treat that. So it provides you with the solution to your heavy painful period and contraception at the same time. Which is fantastic.
That is perfect, for lack of a better word.
It works very well. Other hormonal therapies include even things like oral contraceptive pills for women who have irregular periods because of just a hormonal abnormality or polycystic ovarian syndrome. We can regularize their period using a contraceptive pill for a short amount of time, and then they can discontinue, and hopefully their period cycle returns, back to normal. We have other therapies for hormonal problems. For example, if you have a thyroid problem and that's the thing that is causing your irregular periods, then you should take medication to normalize your thyroid levels. So if they're high, we can lower them. If they're low, we can raise them, and that would ideally help your period to restore back to normal. We have surgeries like hysteroscopic removal or hysteroscopic surgery for fibroids that are inside the cavity of the uterus. So we go with the camera, as I mentioned, remove the fibroid that's inside the cavity. We could remove the polyp that's growing inside the uterus in the same manner without cutting you at all. We just go in with the camera, find it, remove it, and come out. If, of course, you have extensive cancer, then you need, chemotherapy, radiotherapy, surgery, because maybe it's the cancer that is causing you the bleeding. If, for example, you are towards menopause, we're not going to restore your period, but we're going to reassure you and counsel you and tell you, like, look, this is something that you should expect. So the treatment really relies heavily on what the cause is. Once the cause is established, the treatment is able to be given to the patient in the appropriate manner. Women who have, for example, polycystic ovarian syndrome, one of the newer therapies right now is myo-inositol, which is able to treat their insulin resistance and restore the polycystic. If it may not cure, but it manages to a large extent polycystic ovarian syndrome. So knowing the diagnosis is very, very important. Both of us may be bleeding heavily, but I may be bleeding because of our polyp, and you may be bleeding because of our fibroid, and so our therapies will be completely different. So another solution to painful periods sometimes is just medication in terms of pain medication. In the endometriosis protocols, the international ones, sometimes they say you just need to start off with medication such as Brufen and see whether that's going to work for a few cycles. And for some women that's sufficient, but for some it's very extensive and that's not sufficient, and they have to escalate to a second, third, fourth line of therapy. So sometimes a painkiller is sufficient, especially if the pain is not too debilitating. Another solution for older women or women who are done with having babies is simply having a hysterectomy, because really there's no need to have very painful, very heavy periods at a very advanced age. When the uterus is a child-bearing organ, its purpose is to hold a baby. So if childbearing is over, it's very unfair when a non-vital organ makes a vital organ stop functioning. The uterus has a function of carrying a pregnancy. Once that function is over and the person is sure that the function is over, they keep experiencing these symptoms. It's not fair to make your uterus make you lose your kidney, or it's not fair to have your uterus make you get a blood clot and die. So if you're sure and you're up for the surgery and your gynecologist has explained to you all the benefits and risks, a hysterectomy is actually also a solution to very severe abnormal periods.
So all in all, seek expert help.
Yeah.
Go see your gyna. We always say frequent checkups.
Yeah.
And this is where you whenever you know your body best, you know when this is abnormal and it's not normal.
Yeah.
You've been living in that body for as long as you've
been alive.
As long as you've been alive, and so you know what is abnormal and not abnormal. And like we say, it's better to go see the gyna and they send you home with there's no issue. And if they are, like we've heard in this video, that there are ways to diagnose, there are treatments, there is hope. But as women, we need to be woke and we need to take care of ourselves. Thank you, Dr. Ari, for coming on set today.
Thank you for having me.
Again, free consultation. I always tell Dr. Ari, every time I meet her, it's free consultation. We learn every day. I've learned a lot from this video. Ladies, if you have any questions for Dr. Ari, you can leave them on this video on the inbox. You can also reach out to Dr. Ari at her clinic. You can let them know, those who don't know, where your clinic is situated.
Yeah, my clinic is at Upper Hill, Alora Medical Practice in Fortis Suites, 6th floor, Suite 1. I'm happy to answer questions, during a physical consultation or during DMs. If there are some things that are not understandable, you can also plug into my channel. It's called Your Free Consult on YouTube. There's some detailed explanations about some of these conditions as well.
Okay. And if you guys want to have a series with Dr. Ari, if you want more of these videos, let me know the topics you'd like to discuss. Let me know in the comments below. And thank you very much for watching. And until next time, bye-bye.
Bye.